disappointed that the government hasn't worked out how all this started by now?
That's up to them.
Given that you locked down Northern Beaches when there were so many cases, why not do a 10-day lockdown, say, in Greater Sydney now there are so many cases, at 150 cases really across?
Well, we don't feel that the health advice doesn't request that at this stage. The health advice is still such that we have a handle on current outbreak. I mean, obviously the CROYDON cluster is concerning because there is no established link. All the other cases, there is some crossover with venues or regions that we've identified as a concern. And because of that concern, because of the CROYDON cluster emerging, and that case, the first case actually came in, we reported yesterday, it was very late the night before, and given what's occurred during the day has prompted us to take this decision. So we've acted immediately, as we will. But we obviously, the data that we get is ongoing information to us, and if the health advice ever changes, I've demonstrated already my government is quick to act. We will change the settings in place, but we also at every stage rely on people to do the right thing as well. Common sense is important, following our advice is important. Even though the health orders allow you to do certain things, you've still got to make assessments to yourself as to what is safe and whether your vulnerable family members should be exposed, whether you have a symptom and should get tested and stay home and not participate in any gathering where you could expose yourself. And the worst thing any of us can do is unintentionally give the virus to those closest to us. And none of us want to see that happen, and that's why we've taken the action we have. I think I indicated yesterday and the day before that Greater Sydney is on high alert, and that's certainly magnified. But I also want to stress that especially, as Dr Chant has highlighted, we're in some cases at the tail end. We are going to see the numbers bounce around because as time progresses and people with the infection have gone home, they may have given it to their household contacts or close contacts. And as we've seen, some cases are emerging or symptoms are emerging very late in the isolation period, day 11 or 12. So it's really important to maintain that 14 days. And please, can I stress, we are relying on people following the health orders. We're also relying on people exercising their common sense and not putting themselves in a situation which makes them or their family member vulnerable. And no matter what great policies or health orders we have in place, you can't cover every single exceptional circumstance, and that's why common sense is so important. Of course, police will be out in force, our regulators will be out in force to make sure businesses are complying as well, but we can't guarantee that 100% of the time 100% of the population is going to be doing the right thing.